Korina Pateli-Bell is the president of advocacy groups for lung cancer in Greece. And we are moving from model-centric AI to patient-centric AI.
Thank you very much. As a patient advocate and in my role as founder and president of FairLife, I'm really honored to be with you today and talk about the benefits of AI, especially on oncology patients. I would like to extend my thanks to the organizational committee and to Dr. Linardou for the invitation. Dr. Linardou is an exceptional expert in oncology and an honorary member of FairLife board member. And she gave invaluable support during our fight with lung cancer and my husband. However, I believe that AI would definitely support medical experts and enhancing oncology. However, will never replace the empathy and the compassion of dedicated health care professionals. So I will try to be as quickly as possible. I know that we have to go. So one way to see how AI can benefit patients, and especially oncology patients, is to understand the numerous challenges that currently healthcare landscape faces, including misdiagnosis and delayed treatments, and limited access to innovative therapies. So traditional diagnosis methods rely heavily on human experts, which, while invaluable, is subject to human error and variability. So the administrative burden of healthcare professionals can lead to inefficiencies, while geographic and logistic barriers often prevent patients from accessing the best possible care. So the above-mentioned challenges, especially for disease like with progression like cancer, demand timely and precise intervention, which the current system sometimes struggles to deliver. So AI-based devices have already started to offer advantages for treatment for cancer types, especially like breast and lung and prostate, with FDI having approved most of the AI-based devices within 3 tumor types. For example, in lung cancer, AI algorithms have shown remarkable capabilities in the detection and characterization of lung nodules, thereby aiding in accurate lung cancer screening and diagnosis by analyzing various images accurately, identifying suspicious nodules, and facilitating timely intervention. Furthermore, by ensuring that the data is gathered and utilizing high-quality data, AI models can even predict treatment responses, such as the likelihood of response and recurrence, and guide the selection of optimal therapies. So I thought it might be interesting to try to showcase the benefit of AI might bring to a patient individual level, as I'm not a doctor, by attempting the transform of my husband's real story to a hypothetical scenario with the assumption that AI was used along with his own journey. So that was our initial scenario. In July of 2019, Simon experienced persistent coughing and requested medical advice. And unfortunately, he was misdiagnosed with a simple infection and was given antibiotics. A month later, the severity of his condition became apparent when he was diagnosed with adenocarcinoma. This delay in accurate diagnosis significantly impacted his treatment option and prognosis, while the pandemic restricted his access to potentially life-saving treatment in the USA. So, what would have been the hypothetical scenario? With AI diagnostic tool that would have been available, Simon's initial symptoms and health records could have been analyzed more comprehensively. AI trained on vast data sets might have detected the patterns of malignancy, so he would have been analyzed all the radiology X-ray, etc., etc., and something that the human eye might have missed. So AI ability to detect minor anomalies could have led to an earlier diagnosis. So Simon cancer could have been detected earlier, allowing for prompt and potentially more effective intervention. So that was the second real scenario. Upon diagnosis, Simon faced a daunting task of navigating treatment options because his disease was rapidly advancing and there was no left room for trial and error. So the hypothetical scenario could have analyzed Simon's tumor genome and to identify specific mutation and biomarkers, enable him a personalized treatment plan tailored for his cancer genetic profile. So the third real scenario was that Simon's best hope was to be part in an innovative treatment available in the clinical trial in the USA. However, the COVID pandemic and associated travel restriction prevent him from assessing this treatment. So the hypothetical scenario, AI could have scanned global databases to identify suitable clinical trials for Simon's condition, streamlining his enrollment in innovative treatment studies. Therefore, Simon might have access to a clinical trial efficiently, overcoming logistical and bureaucratic hurdles and progression, allowing timely adjustment to his treatment plan. Furthermore, AI-powered telemedicine platform could enable Simon to consult with oncologists worldwide to collaborate with his local team, which was excellent. AI-assisted remote management could handle the dosage adjustment and manage side effects based on real-time data, overcoming the need of physical travel and pandemic restriction that was implemented at that time, and also save money for the family and in general for the system. So the fourth real scenario, Simon's condition required constant monitoring to manage symptoms and adapting to adapt the treatment. I was writing notes, I had Excel files, filing to talk with the doctors, measuring his temperature. I mean, I was 24/7 trying to monitoring the side effects and what was going on that was changing from time to time. So with a hypothetical scenario, AI integrated wearable devices could monitor Simon's vital signs and symptoms in real time, providing continuous data in the healthcare team. So furthermore, with AI algorithm could predict adverse reaction of or disease progression, allowing timely adjustment to his treatment plan. So the outcome would have been that Simon's treatment could have been continuously optimized, improving his response to therapy and overall outcome. And this is the fifth scenario, the fifth real scenario, navigating the emotional and logistical challenges of cancer treatment was a significant burden for our family and Simon himself. So the hypothetical scenario would be that AI-driven chatbots and virtual assistant could provide Simon and our family a 24/7 support, answering questions, we had many questions, and my kids had many questions about his condition and treatment options. I look my son now that he was judging me for not telling him from the beginning the severe cause of Simon's disease. So, because I think it's important to know what's going on in the health condition of someone and not keep it secret from your kids. So this is the scenario that we wish would have happened. Access to innovative treatment often involves navigating complex regulatory landscape. So AI could assist in navigating the legal and regulatory landscape, ensuring timely approvals for experimental treatments. AI could facilitate coordination between healthcare providers, regulatory bodies, and pharmaceutical companies. The outcome: Simon might have received access to the necessary clinical trial, avoiding delays caused by regulatory and bureaucratic challenges that at the end cost his life. So, having said all the above, overall, what would have been the final outcome for Simon and for many other patients? Because since then, through FairLife, we have faced many similar stories. So his journey through lung cancer highlights the critical need for advancement in medical oncology. AI integration into his healthcare journey could have potentially led to earlier detection, personalized treatment plan, seamless access to clinical trials, continuous monitoring, robust support, and potentially access to an innovative treatment that could have altered his journey with lung cancer. This would have improved his chances for a better outcome, quality of life, and maybe Simon would have been here to talk about his survivorship. I would like also, I have 2 more minutes, okay. Last but not least, I want to say a few words about the patient, at the patient organizational level. Because I think also it is important, okay, let's put it very compressed, because I think, okay, something which is very important is that at patient organizational level, AI could help us to create educational material for patients and caregivers, ensuring that they have access to the latest cancer care information. Also, AI chatbots and virtual assistants could offer continuous support, answering questions, providing information, and offering support to patients and families. Additional AI enable patient organizations to collect and analyze data on patient experience and outcomes, identifying care gaps and advocating for necessary changes. As advocates, it is essential to highlight these benefits to ensure AI is ethically adopted to improve patient lives, and illustrated by Simon's transformative story. I think I'm going very fast, but I don't have any other choices. So I think I'm going to skip that. I wanted to say a few words about FairLife, but I'll skip that. And what I want to say at the end is that AI algorithms should only complement and not replace physicians. Humanity, compassion, empathy, and psychological support should always be there for the patient, the family, the caregiver, from the beginning until the end of the disease journey. Thank you.